COVID isn't gone, but our cases and our hospitalizations are decreasing. I'm Rob Freelove, Chief Medical Officer and Senior Vice President at Salina Regional Health Center.
Doctor, thank you so much for coming on the show to give us a COVID update. Why don't you give us those COVID numbers?
Sure. Well, finally a little bit of good news. We've seen a pretty dramatic decline here in the number of cases of people testing positive here in our community, in our county. That probably started about 3 weeks ago, and then just like it always has, hospitalizations have started to decline slowly following that. So we're running in the low teens right now as far as hospital inpatients. That's a lot better. You know, we were kind of in that 25 to 30 range for several weeks, and then it seems like here over the last few weeks, each week we kind of went down a little bit. So we're in a good place now. I'm hopeful that here soon we'll be back into single digits and as we move into the spring and summer. So, but all in all, a much better picture than the last time I was on. We've been able to resume doing some surgeries and things that we were postponing. It's nice to be back at a point where we're allowing the outpatient surgeries to happen, and even some of the non-urgent, more elective cases that require an overnight stay. We are doing more of those now. We've also been able to change our visitor restrictions a little bit. Last week we went from just one at a time. Now we're allowing actually 2 visitors for our inpatients at a time. We're still asking for just one support person or companion for all of the outpatient stuff, just to kind of try and keep that traffic at bay a little bit.
So I don't know if you've got your crystal ball out, because I was going to ask you a question about the future and where we are going forward.
Sure. I'm an optimist at heart, and so I guess I'd say I'm cautiously optimistic. I'm hopeful that this helps kind of reset things, and we get to a little more routine kind of cyclical thing that we can anticipate a little bit better. COVID's not going away. It's here now. I mean, it's like influenza. It's here. It's always going to be part of the landscape moving forward. It's just a matter of what does that look like? How often are we going to have increases in cases or surges? How often is that going to come around? And what are we doing? Are there going to be more treatment options? Yeah, there probably will be. Should there still be a really strong emphasis on prevention? Absolutely. Vaccines work. They still work, and people should still be getting them. There's another option that looks like is probably going to be FDA approved here relatively soon that is a little bit older vaccine technology. So hopefully some people who are uncomfortable with the newer technologies that are out there will be a little more comfortable with that, so we can get a few more people vaccinated. So all of those things help, but I'm hopeful that at the very least this sets us up for a nice spring and summer.
Thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.